Thank you, Dr. Dickerson, for the introduction. So it's so nice to see so many familiar faces here today. For those of you who don't know me, as Dr. Dickerson said, I'm a speech-language pathologist and the director of the Speech and Language Program in the FTD unit. Today I'll be talking about primarily primary progressive aphasia. And topics I'll cover are what is primary progressive aphasia, some communication challenges, as well as some therapeutic approaches. Some important terms to understand are the difference between language and speech. So language is the expression and understanding of thoughts, ideas, and concepts through a shared symbol system, and there are different ways to express your language. One way is through speech, the physical productions of the sounds of a language, but there are also other ways to express language, for instance, writing, gestures, sign language, etc. An aphasia is a language disorder due to damage to parts of the brain that's started after birth. You can have aphasia for many different reasons, for example, a traumatic brain injury, a stroke, or a neurodegenerative disease. Primary progressive aphasia is called that because it's a language disorder, so an aphasia that worsens over time, so it's progressive, and the primary symptom is the aphasia. Dr. Dickerson mentioned this a little bit, but when we're diagnosing patients in the clinic, we often ask patients as well as family members, what were the initial symptoms, especially in the first 2 years? Were the symptoms isolated to language or primarily language symptoms? Because in primary progressive aphasia, that's how it begins. In the later stages, other symptoms may occur, for instance, changes in motor function, behavior, or cognition. And individuals with other clinical syndromes that we work with may also have communication challenges, but that's not their main difficulty. I'll be going over the 3 different subtypes of primary progressive aphasia. There's the non-fluent agrammatic, the logopenic, and the semantic. So as I describe these 3 different subtypes, I'll provide speech and language samples of patients describing this picture. So just keep this picture in mind. It's a picnic scene, a family having fun at the beach, there's a house, someone building a sandcastle and flying a kite. The first subtype that I'll be speaking about is the non-fluent, or also called the agrammatic subtype. The most prominent feature is non-fluent speech, and this may be due to articulation difficulty, so difficulty pronouncing sounds and words, maybe false starts, word finding difficulties. And when some of these patients have articulation difficulty, as I mentioned, and that's something we call apraxia of speech, but not all patients have this. There's something called agrammatism, and what that means is there's difficulty producing and understanding complex grammar. And even in reading and writing, that might be impaired, because if the material incorporates complex syntax, sentences with complex grammar, it might be difficult for the patient to understand that. And these patients have word finding difficulty, but it's not as impaired compared to the other subtypes that we work with. So this is a non-fluent patient describing the picnic scene I showed. Thank you, Dr. Dickerson.
Bo flying a kite, boy by flying a kite, and garage, car garage, parked in the garage.
So as you may have heard, the individual is having difficulty putting together sentences, full sentences, as well as having difficulty pronouncing certain words. And for this subtype of PPA, sometimes in the later stages, patients may develop some motor difficulties. So this is a non-fluent agrammatic patient describing, it's just a conversational speech sample of her describing gardening.
Waiting my garden yesterday. Was waiting my garden.
Waiting? Can you write it down for me?
You
Weeding her garden.
Oh,
yes.
weeding your garden. I'm sorry.
Allergic AC.
You're brave keeping a garden when
Yes,
you have
yes,
allergies
yeah.
like that. Wow, it's amazing.
So the
AC makes me congested.
can you say the full word for AC?
Air conditioning.
Okay.
Air conditioning.
Good.
Ing.
So again, you may have heard difficulty pronouncing words and putting full sentences together.
Waiting my garden yesterday.
So the next subtype of PPA I'll be discussing is the semantic subtype. And unlike the non-fluent subtype, patients with this diagnosis, their speech is fluent and grammatical. However, there's a lot of use of vague and general words like thing and over there and stuff. And so the speech ends up having an empty quality to it, as well as if you were asked an individual with semantic PPA, what is a bicycle? What is a car? Oftentimes it has a personalized content to it, so they'll describe their actual bicycle or their actual car and things like that. They may have something called surface dyslexia, which is difficulty recognizing certain words and reading, especially if they have an irregular pattern to them, and difficulty understanding words. So if you asked a patient to hand over the knife, they might ask, what is a knife? Things like that. So this is an example of a semantic patient describing that picnic picture that I showed you.
So they're sitting right there. She's playing something with it for maybe some water or something. He's reading an item.
So very different from the non-fluent PPA subtype. It's fluent speech, but as you can tell, very vague language, like that item over there has stuff on it. So if you didn't have context, you actually might have some difficulty understanding what the patient is talking about. And with this subtype, sometimes patients have changes in their behavior. For instance, sometimes they may become more childlike than they used to be. And as I mentioned before, they have difficulty understanding words. And so in this next video, this is a person who's so wonderful and so sweet that I have the opportunity to work with. What is happening in this video is a clinician is naming an item, and then the individual is asked to point to the item in a set of 10 different pictures, for instance, a set of 10 different animals. And she doesn't have to name the items. She just needs to point to the item that the clinician is saying to show that she is understanding which item she's asking for.
I don't know what pliers are. Is this a plier? Yeah, what kind of animal are we going to look at now?
Squirrel.
Squirrel. Okay, it's official, I don't know.
Try guessing.
I'll guess this is a squirrel. I don't know.
How about the camel?
Camel. I want to say this is a camel, but I don't know either.
Peacock.
Peacock. I don't know what a peacock is.
Try guessing.
I'll guess this.
So as you can see, difficulty understanding those single words. For peacock, she didn't even recognize the word at all. So it's possible that if there weren't pictures of animals, she may not know what a peacock is or semantic features of the item that was asked for.
I don't know what pliers are. Is this...
The logopenic subtype of PPA has inconsistent fluency, mostly because of word-finding difficulties. So they may pause to try to think of the word that they're trying to say. So it's not completely fluent, but some pausing. They have something called phonemic paraphasias a lot of the time. So a single sound of a word is different than the target. For instance, clate for plate. They have impaired naming, as I mentioned, and impaired sentence repetition because they have trouble with working memory. For instance, they may hear something and they can't keep it in their head long enough to manipulate it and, for instance, repeat it back to someone. And oftentimes, this subtype has underlying Alzheimer's pathology. So this is a sample of a logopenic patient describing that picnic scene.
A woman and a wife were sitting in what do you do? You have things there, and the kids are all playing out there, and they live over there, and it's a picnic over here. They may also be the people who own the boat there too.
So as you may have heard, some phonemic paraphasias, as I mentioned, and some word-finding difficulty saying that thing over there, etc. As I mentioned, they have difficulty with auditory verbal working memory, so difficulty keeping things in their head long enough to repeat it back. So in this video, a clinician is asking the patient to repeat some phrases and sentences.
62 and a half.
62 and a half.
Perfect. The pastry cook was satisfied.
Can you give me that?
The pastry cook was satisfied.
Oh. What was the? No, I'm not getting it. I'm sorry. Could you do it?
I'll give it to you one more time.
She was okay with phrases, but as soon as a longer sentence was asked for, she had difficulty producing it back. Later in the video, it's apparent that she knows the gist of the sentence, like the meaning of the sentence. For instance, she said, eat, there's a person, that's okay, but had difficulty saying the exact words back to the clinician.
62 and a half.
62 and a half.
Dr. Dickerson and Daisy Hochberg created a progressive aphasia severity scale, which is used to help diagnose and monitor patients over time. So there's a lot of different speech and language areas that we need to monitor, and there's a scale that goes between 0 and 3 for normal, between non-functional. That helps us monitor and see how patients are doing in all of these different areas. And it's been used all across the world. I'm constantly getting requests to use the scale, which is really exciting because that means other centers around the world are using this to monitor their patients with primary progressive aphasia. Now I'll talk a little bit about the communication challenges. For PPA, as you can imagine, it must be extremely frustrating and anxiety-provoking to know what you want to say but not get the word out. So this may make them feel self-conscious or rush to get their thoughts out. And because a lot of activities in life revolve around communication, they may have a loss of previously enjoyed hobbies and activities that they had in the past. Communicating the problem to others is very difficult, especially if you have a communication problem, but it's a very rare disorder, as Dr. Dickerson mentioned. So people who don't know the individual might think that something else is going on because they're having difficulty communicating, even when they only have an aphasia. And adjusting to a new communication style is clearly very difficult, especially for the non-fluent agrammatic patients, because if they have a lot of difficulty speaking, they may have to rely more on written communication or technology and iPads and such to get their words out. I'll talk a little bit about the communication challenges that behavioral variant FTD individuals have. So because of changes in behavior and personality, This may lead to changes in apathy. So they may have difficulty initiating in conversation and engaging in conversation, and understanding emotion and expressing emotions, which can be very difficult for family members when this happens, when they're less involved and engaged in activities and conversations with them. And disinhibition may lead to having difficulty reading social cues or inappropriate increase in talking, and saying inappropriate things during conversations when they're out with family members, or even changes in empathy can lead to patients saying some hurtful things sometimes. For Alzheimer's disease dementia, changes in memory and behavior can lead to having difficulty finding words, use of vague and tangential language. If you ask them a question, they might be talking about something else and not come back to the question, and a decline in understanding conversation, as well as changes in behaviors, difficulty reading social cues, or a decrease in social engagement. The number one question that our team gets in, at least that I get in our clinic, is family members will come to us and be like, how much is my loved one understanding? And that's really difficult to understand, especially because a lot of the patients I've worked with compensate very well. And so some signs of impaired comprehension can be that they cannot follow instructions. So if you tell them to do something, they don't do it in the right way, or little purposeful behavior. And we are more than happy to assess this more closely when you come into the clinic. A little bit about therapeutic approaches. The speech and language team later in the day will be holding a workshop, and we'll go into a good amount of detail about the different therapeutic approaches that can be used with different types of patients. But for speech and language therapy, it's different than the traditional speech and language therapy that patients who've had a stroke, who have an aphasia, have. Instead of maybe memorizing a word list or it being rehabilitative, really for PPA patients, or patients with a communication difficulty that is progressive, we really are focusing on compensatory strategies. So to kind of get around the impairment, instead of trying to get the patient to think of that exact word that they want to use, which may increase anxiety and frustration, really, for instance, talking around the word. So if the patient, let's say an easy word to describe this, if they're trying to think of the word apple and they can't think of the word apple, then you might think about, what does it look like? The caregiver can ask, well, what does it look like? Can you tell me what it looks like? So red, small, maybe even use a gesture of how small it is. Where does it appear? Like maybe they say a store or a grocery store. And what is it used for? So they might gesture eating, or say the word eating. And then there are some other compensatory strategies. For instance, a personalized communication notebook can be very helpful for some patients, especially semantic patients, where you could put together a book in a very organized, personal way. For instance, patients' favorite restaurants, or their doctors, or their family members, or rooms around their house. So that way they don't have to think of the word that they want to say, and instead they can point to the book and convey their message that way. And working with the caregiver is extremely important. So it's not only the patient who has to change the way they're communicating with their family members and people around them, it's also the family member who has to adjust a new way of communicating with their loved one. So it's really important that the caregiver is involved in the treatment as well. And the goal is functional communication. So using their strengths of speech and language to get their message across in any way they can. We're not aiming for perfection. We're just trying to use their strengths to get their message across. It's always surprising to our team when a patient, comes in for testing and their language may be very impaired, but they compensate very well by using some of these strategies and treatment to convey their message. And cognitive rehabilitative therapy can be very helpful for some patients who have difficulty in executive functioning or memory. Really what that involves is things like helping them create to-do lists and a planner and ways to organize tasks in their life, so it's more likely that they can do it more independently, maybe eliminating some of the distractions in their life, external distractions being, you know, like noises or smells or things like that. And then internal distractions, thinking of times that are good to do certain tasks or to communicate, like when they're not stressed or tired and things like that. And working with the caregiver to think of reminder systems, you know, whiteboards, pictures around the house, calendars that can help make the process for the caregiver as well as the patient more easy. And support groups are really helpful for these patients, for PPA patients, especially in the mild stages. You know, it's very unlikely that a patient with PPA will meet another person with PPA. And it's very different from all of these different clinical syndromes that we're talking about. So I've seen that it's really rewarding for patients to meet other patients. And for caregivers, you know, also it's especially important to meet one another and ask each other questions and how, you know, how did they deal with certain situations, and just to feel supported by the community so you feel less isolated. I think that's really important. And so thank you for having me speak today. I really appreciate all of your attention.